Hey everyone, Michelle Lee here from WISC-TV in Madison, Wisconsin, and we are getting ready to deal with the Affordable Care Act deadline, which is at the end of March. And in light of that, we're going to have a special phone bank on Tuesday, March 18th, which will give all those details at the end of this hangout. But right now I want everyone to kind of introduce themselves. These are Wisconsin's who's of the ACA. And so if we could, thank you guys so much for being here, but if you could just introduce yourself and tell people what you do.
I'm Sarah Valencia, the Director of Medical Operations at Access Community Health Centers, and we have outreach and enrollment specialists that are certified application counselors that are assisting our patients in our clinics as well as assisting people in the community at the Dane County Job Center in applying for marketplace products or Badger Care.
Okay, Sandy?
I'm Sandy Erickson, with Director of Community Impact at United Way of Dane County, and I am managing the Health Connect program, which is a one-of-a-kind program to help folks between 100 and 150% of the federal poverty level to pay their insurance premiums if they live here in Dane County.
Hi everyone, this is Danielle Zirkle. I work with Covering Kids and Families, and we are an organization that's based out of Madison. My office is actually in Milwaukee. But we've been spending a lot of time trying to inform consumer and professional groups about the Affordable Care Act and changes in Medicaid and Badger Care Plus in Wisconsin, and just trying to get as many people as enrolled in coverage as possible.
I'm Amy Mendel-Clemens from Dane County Human Services. I work here at the Job Center. It was our understanding 92,000 people were expected to lose Badger Care Plus coverage. We've been actually busy processing applications that have been referred over from the marketplace, and we've processed here in Capital Consortium about 6,000 applications that were referred here for Badger Care Plus from the marketplace. And we'll continue to receive applications from them and continue to process those. People should be hearing next week, after the 22nd, they'll be getting letters telling them whether they're for sure supposed to go to the marketplace off of Badger Care if they can stay on Badger Care. So it'll be important for people to watch those notices and make sure they pay attention to them.
What do you think is the biggest thing that you guys have seen with the upcoming deadline?
I would say the biggest thing that we've seen are people that are that have waited until this point to apply that are now coming to get their application completed. We're seeing quite a few people per day coming in to get their application submitted. So we're just seeing kind of a final push.
What are the numbers so far? Do you know, or do you have an estimate in Dane County?
We haven't seen any Dane County specific numbers. We've actually been waiting for them. All that we've seen have been statewide numbers right now.
Mm-hmm. Okay. And statewide, what was the last check? It was like 171,000 or something close to that?
I'm looking at the statewide numbers. I think at the end of February they determined that about 158,000 people had been determined eligible for a marketplace plan, and about 71,000 had actually selected a qualified health plan. And then an additional 69,000 were determined eligible for Medicaid.
Okay. Now, Danielle, you are part of a couple of other phone banks that were going across the state, right? Can you talk about that a little bit?
Yeah, definitely. We've held 2 phone banks in Milwaukee over the past few weeks now. We worked with Channel 12 to host the phone banks, and so we had 10 different enrollment assisters available from 3 to 7 for a good 4 hours, and our phones rang nonstop. From the time the phones went live until we had to cut them at 7. We estimated the last one that we held last week, we probably talked to close to 700 people. And so, yeah, it was just really amazing to see, you know, the need for the information still as we near the end of open enrollment. You know, hundreds of people are still looking for clarifications on whether or not they're eligible for coverage, and basic things about, you know, where to go, who to call, what website to go to, how can they get that in-person assistance. So we're really impressed by the amount of calls we received, and, you know, really just found it very interesting that there was so much need for information still as we reach, you know, the end of open enrollment.
What are some of the things that you tell those people? When they're asking the basic question.
Sure. Basically, you know, just really encouraging people to apply for coverage as soon as possible, noting that the deadline is March 31st for marketplace coverage. Also, really informing people that if you're eligible for Medicaid, which is Badger Care Plus in Wisconsin, you can apply at any time throughout the year. And then just letting them know you can go to healthcare.gov, which is the federal website. You can go to access.wi.gov, which is the state website. You can call the federal call center to apply over the phone. And then in our area, you can also call 211 to find a list of local enrollment sites. And so really just trying to help them identify who in their community can provide that in-person assistance, because we know that that's really wanted by many people.
This is Sandy with Health Connect, and we have definitely seen an increase in Dane County residents applying for this premium assistance program. All along, we've had applications from people who previously had been uninsured, and over the last couple of weeks, we have started to see more and more applications from people that had been insured with Badger Care and will be losing that coverage at the end of this month.
Can you talk a little bit more about Health Connect, Sandy?
Yes, I'm happy to. Health Connect is made possible by a wonderful gift to the community from UW Health, who was particularly concerned about this transition that is happening with folks on Badger Care who have been insured, and those above 100% of the poverty level will be transitioning off and needing to purchase their plans through the marketplace. The concern was that they might not be able to afford even this minimal premium that they would have to pay, even with premium tax credits available that are provided through the federal government. So they approached United Way and wondered if there was a community solution to this issue, and ultimately what came about was Health Connect, which is available for folks in Dane County who purchase a silver level cost share reduction plan on the marketplace, and they can be with any of the 4 insurers here in Dane County. So that includes the Unity products, Dane, Group Health, and Physicians Plus. So folks who qualify simply fill out a Health Connect application on the United Way of Dane County website. It's very simple. And assuming they meet the 3 criteria of living in Dane County, having purchased their plan on the marketplace, and then are within those income guidelines, they will be approved through our office, and then we just verify with the insurer that they have received the person's insurance application through the marketplace. Once we get that verification, then we are ready to go, and we are now paying premiums for over 300 people in Dane County.
Oh, wow. I'm wondering, is that what you guys are hearing? Because we have a lot of concerns from people who are saying that they still won't be able to afford it. Were you getting any questions like that in the phone bank, or have you guys, just being at work, heard any of that?
I mean, I can speak from our experience. That cost is a real concern, especially when you have the transitioners leaving Badger Care Plus coverage where they were paying very little, if nothing, for their coverage, or to those folks who have been uninsured in the past and aren't used to paying a monthly premium. Any little amount, even if it, the normal family would consider to be affordable, can be an expense that can be difficult to pay. So, we have seen that. We have heard that concern.
And I certainly have spoken with folks who have indicated that were it not for the assistance available through Health Connect, they, would have to go without their insurance coverage and therefore end up paying the fine when taxes are due next year.
Okay. I don't want to keep you guys too long, but could we go through some of these questions just in case they don't get a chance to call the phone bank? This one is from Ken, and Ken asks, if a young couple loses Badger Care due to a significant increase in income, can insurance be obtained under the Affordable Care Act after the March 31st deadline?
Yeah.
Yes. Oh, go ahead, Danielle.
Oh, please, go ahead.
I was just going to say yes, that would be considered a qualifying event in that couple's life that would then allow them to apply for coverage on the marketplace whenever that event were to happen.
And just to add to that, we received a number of questions like that on the phone that we had earlier. So anything that qualifies as one of those life qualifying events triggers a special enrollment period. So if somebody loses coverage or changes zip code, loses income, anything like that, they have 60 days from that time to apply for coverage in the marketplace.
Here's a message from Karen. She's from Oregon, and she says, can I fill out the information to see what it would cost me and not be obligated to sign up for it if it is more expensive than what I already have?
This is Sarah from Access. Yes, you can go on the website. You can enter your information in. It will show you what you're eligible for, and then you decide at that point if and what you want to purchase based on that information.
Elena has a question. She says, I am wondering if UW Unity Insurance through the ACA covers mental health. I tried looking for my provider under several silver and a couple of gold plans, and it always came up saying they were not listed. I would like to know if I can still go to the Wisconsin Psychiatric Institute and clinics. It looked to me like ACA did not cover mental health at all. Does ACA cover mental health?
Sarah, you want to take that one?
My understanding is that behavioral health is one of the essential health benefits of the Affordable Care Act, and that yes, it does cover behavioral health, although the different insurance companies can determine who their providers are going to be. So that is something that that person would, either through looking through the Unity directory online or calling the Unity customer service line might be a more effective way to really understand what providers that plan would cover. But behavioral health is an essential health benefit covered by all of the plans on the Affordable Care Act.
Yep. And I would just add to that as well, the person could definitely call their specific provider, either the financial benefit counselor, whoever's at that agency, and ask them specifically which plans they are contracted with, so they get a straight answer as well.
With this last push, how has your workload been? Has it been smooth, or has it been frustrating?
Well, from the Health Connect side, we have planned for it, and it's been relatively smooth. Anticipating it's going to get a little bit busier before the end of March.
So we've been doing pretty good, but we will be really busy in the next week and a half.
Is there one last thing that you want to resonate with folks out there before that deadline?
I would just say to anybody that is uninsured right now to go on to either the state website or healthcare.gov, the federal website, put in your information and see what you're eligible for so that you can get signed up. If indeed you're eligible for the Marketplace and Affordable Care Act product, to get signed up before March 31st.
I would want to add from the Health Connect side that I believe Sarah mentioned earlier about people who have qualifying events, so they end up looking for health insurance at other times during the year. And as long as we have money available, people would still be able to apply for Health Connect even after March 31st. If they meet the guidelines.
It improves coverage for people that already have that coverage, and then really, provides a way for people that have been uninsured, a great way to access coverage through the Marketplace. One big piece of that is that young adults can stay in their parents' private plans until they're 26. And then other folks that haven't had access to coverage in the past because of pre-existing conditions or because of cost now can apply through the health insurance marketplace and get comprehensive and, for the most part, affordable coverage.
I want to thank you guys for, again, taking the time to chat with us. We believe that it's really important, and we certainly appreciate all the work that you do.
Thank you.
Thank you so much.
Thank you.
See you tomorrow.
Bye.
Bye.
Bye.